I want to introduce our program leads. We have Dr. Anita Palepu and Dr. Raymond Ng joining our info session today. Anita Palepu is a professor, Eric W. Hamber Chair, and the head of the Department of Medicine at UBC and Providence Healthcare. She is also the co-lead of the Data Science and Health, or DASH, Research Excellence Cluster. And Dr. Raymond Ng is a professor of computer science at the University of British Columbia, as well as a director of the Data Science Institute, and he is a holder of the Canada Research Chair on Data Science and Analytics. Today, we also have instructors joining us, the course instructors, so Dr. Joseph Pewitt, Leon Ruocco, and Dr. Rob Bergen, who I will introduce a little bit later when they speak. And so now I will pass it to Dr. Anita Palepu, who will provide a little bit of a program overview for the certificate.
Thanks so much, Steph. So health data analytics is really about making sense of the vast amount of information that we collect in healthcare. And it uses tools from data science like statistical analysis and data mining to uncover hidden patterns and trends that we see in patient data. So these insights can be incredibly powerful. They can help clinicians predict outcomes, tailor treatments, and make more informed decisions at the point of care. So for example, by analyzing historical patient records, we can predict the likelihood of someone being readmitted to hospital or identify those who are at risk of adverse drug reactions. So this allows for earlier interventions and better outcomes. So you have to think of it as moving from reactive care to hopefully proactive data-driven decision-making. So next slide. Let's talk about why we developed the program and who it's designed for. So we developed this program to address the growing volume and diversity of health data alongside the increasing computational capabilities that are available today. So there's a number of advanced data science and AI tools that are available, and we recognize the importance of improving data literacy amongst people who are working in health. So that's why we developed this course to help healthcare professionals upskill and build foundational knowledge in order to apply these new tools and technologies and capitalize on the many opportunities to enhance healthcare delivery and hopefully collaborate more effectively with analytic experts. So this program is designed for a broad and diverse range of professionals who interact with health data in different ways. It's, first of all, highly relevant for healthcare professionals. So that includes physicians, nurses, operational leaders, allied health staff who want to enhance patient care and operational efficiency through data-informed decisions. Second, this program is also useful for researchers, investigators, postdocs, research coordinators who work with clinical and health system data and want to sharpen their analytic skills or apply new methodologies in their work. And finally, it's open to others who may not come from clinical or research backgrounds, but you're interested in how data analytics can be applied within the healthcare system. So this could include policy analysts, like IT professionals or digital health innovators. So in short, if you're working in or around health and want to become more fluent in data, this program is for you. And I think the emergence of AI and all of these tools that are going to be deployed, it's really important for us to upskill in data science. So I'm going to pass it on to Raymond Ng now. Thank you.
Hi, so good afternoon. Thank you for taking the time to join us. And I think that in this session, we want to be able to share with you how a micro-credential program like this could benefit. I'm sure at the top of your mind is career enhancement, and the idea is that you have new knowledge and new skills, new tools that allow you to maybe enhance your existing work in a healthcare setting, or maybe help you to explore whether it's time for you to do a career transition a little bit more into the data science AI arena. We want to make sure that in this program, we are getting experts to be able to deliver the lectures to you. And in fact, the curriculum is designed by experts and also experienced health sector leaders who have been using AI and data science tools. we are also very specific in terms of the context in BC. And so take course 1 as an example. We spend a lot of time talking about BC health data sources. This doesn't mean that it cannot generalize to other parts of Canada or even the world, but we just want to be able to talk specifically about the many data sources and therefore opportunities for machine learning AI work using data in BC. Now, let me come to the other side. The people talk about how AI is going to change the world or change the workplace, and I think in general there's a lot of agreement that knowing how to use AI tools, knowing how to use data science tools effectively is going to help help your work, if not today, maybe next year, definitely in the next few years. And the course is just trying to be able to give you the literacy so that you could learn, so to speak the language that data scientists use in the context of these tools. And finally, I think it's actually a very important point that we do really want to build capacity in BC when it comes to data science, skills and literacy. So this community of practice is the idea that by coming to this course, you might be able to start, doing the networking with people, with like-minded people, or even maybe with your coworkers, so that you start talking about how AI and data science tools could be used, in your work setting. Next slide, please. We are very excited that a lot of our work, the content, really, sponsor or actually given by experts, and they have affiliation shown on this slide. BC Cancer, arthritis, emergency health services, various health authorities, and the Ministry of Health. So we extract a lot of information from all these sources, as well as getting experts who are familiar with this organization to give you an overview in this health data analytics arena. Let me give you a very quick program overview, and this is just an overview. I'm sure in a Q&A later you might have more detailed questions in for each of the courses. So there are 3 courses, 5 weeks each, and 90 hours of total work over the 3 courses. So on average, we estimate about 30 hours for each course, and that include the lecture hours, that include the lab hours, the assignment hours, as well as hours that you would come and talk to the TA. Now, obviously, this is just an estimate. The 3 courses are divided into, first of all, an introduction to big data era and opportunities for better healthcare. So we talk a lot about data sources within BC, of which there are many, and many of you may be familiar with some of them, but actually it is amazing how many amazing data sources there are for BC healthcare. The second course is going a little bit more into data quality and visualization of the data, which is essential when it comes to doing machine learning, doing AI. But visualization is almost always one of the first ways that many healthcare professionals interact with data science too. So this is a key part of course 2, and then finally course 3, we get into the specific methods that are popular now in machine learning, but obviously this is particularly tailored to analyzing health data. And so, so those are the 3 courses, and $995 per course, and for the total is $29.85 for the program. Maybe I want to emphasize before we go to the next slide is that you could take any number of the 3 courses in any order. They are actually by design to be very self-contained. So you might we have students in the past that say, oh, I really want to learn about machine learning, and then they go and take course 3, and then they actually realize, oh, actually maybe I should go back to course 1, and so it doesn't matter to us in what order. They are actually designed to be independent. Next slide, please. And this is intended to be part-time, 100% online. This is in line with one of the comments that Anita made about this is an upskilling opportunity. So it's really designed for you who want to continue your daytime job or your daytime work, and then being able to take this program on the side. The lectures are asynchronous. You could view it at the time most convenient to you. You could view and pause. You could view it 10 times if you want. And so it's completely learning at your own pace. Assignments, discussion boards are obviously asynchronous. However, we do recognize that it is important to have some contact hours with with our lecturers, with our TA. So there's a synchronous Zoom office hours, 1 hour per week in the evening that is optional. You don't need to join if you don't need it, but it's mainly there to help you with your assignments, with your understanding of the material. I think that there's a question on chat asking about accreditation, and here, so this is accredited by UBC Continuing Professional Development, and now there might be other accreditation that some of you might want to ask. So next slide, please. So before I stop, even though Anita talks about who would benefit from this course, I want to generally say that this is a course that is really mainly for literacy. We don't want to give you the false impression that once you have taken this micro-credential, you will necessarily become a professional data analyst, become a professional data scientist. This is really just trying to help you to have the basic understanding, see whether you like the subject matter, and if you do like the subject matter, then we actually encourage you to take other options to further advance your data analytics training so that you eventually will become a practicing data scientist. So on this point, I'm going to hand it over back to Steph.
Thanks, Raymond. So something new for this upcoming September offering is that we've gotten the ministry, the BC's Future Skills Grant, Stronger BC's Future Skills Grant, which means that it's eligible. You can apply for this grant, which is a lifetime maximum of $3,500 if you meet the eligibility criteria, and this course could be covered by this Future Skills Grant. It opened in mid-July and we had a lot of interest, so there are limited spots available for this grant, but you can maybe go to the website and see if there's still spots available. If not, there's a wait list that will be provided for people who were interested in using the Future Skills Grant to take this course. Yeah, so that was exciting, and it did cause a lot of interest in our upcoming offerings. The schedule for the next 2 offerings in 2025 and 2026 is shown here. So you can see course 1, 2, and 3. The next time course 1 starts is September, and then it'll run until the end of December for course 3. And then we have another one in 2026, which will begin in January, and course 3 will end in May. So these are the two offerings that are eligible for the Future Skills Grant. But if you are unable to get one of the spots for the Future Skills Grant because it was limited, you'll still be able to register as long as we have space in our the registration, but you just wouldn't be eligible for the ministry grant. Okay, so now we're going to go through each of the courses for a little more of an overview of what each course entails. We have Dr. Joseph Puyat, who's the instructor for course 1. He's an assistant professor at the School of Population and Public Health and a scientist and research methodologist at the Center for Advancing Health Outcomes. I think he might not be on our call today, so I can just give a little overview of course 1, which is Introduction to the Big Data Era and Opportunities for Better Patient Care. This first course provides basically like an environmental scan of the current landscape of health data in BC. So we talk about what are the available data sets, platforms, and how you can apply data analytics in healthcare delivery. We use specific examples such as AI and computer vision for echocardiography, natural language processing for mental health, and ambulance deployment in healthcare operations. So those who are interested in clinical aspects, operational aspects, or those in research field, there's a lot of different parts of this kind of great overview course for everyone. And the overarching goal for this course is to help participants understand how to identify the right data sets and analysis techniques for impactful health data applications. So we will now, I'm going to pass it on to Dr. Leon Rocco, who's the data scientist at UBC's Data Science Institute, and he's one of the instructors for course 2, Health Data and Visualization. He holds a PhD in physics from UBC and works on AI and machine learning solutions to problems in healthcare. So Leon, pass it to you.
Yeah, hi everyone, and thanks for the introduction, Steph. So I'll be talking about course 2, and we'll give a brief kind of high-level overview of the course content. So I suppose, as the title of the course suggests, we'll be studying key aspects of health data itself, data visualization, but also its importance in terms of scientific communication, and we'll be talking about scientific communication skills more broadly. And so, I mean, Raymond mentioned earlier, data acquisition, storage, and visualization is all a precursor to how data is ultimately analyzed and used downstream, for example, in a machine learning context. So this is really where all of this will sit in that process. To give you an idea of what we mean by this, we'll be discussing how data is processed, cleaned, and ultimately stored. And to this end, we'll be going into some of the specifics of data warehousing. And this is a very important concept, of course, in the modern era of big data. And actually, there's a new module in the course that introduces the concept of data dashboards. And this is another important tool that's seeing increasing use, especially in healthcare settings. And so here you actually get to develop your own rudimentary dashboard using some like very light, sort of easy to use software. We'll be spending significant time discussing how data can be explored from a visual perspective, how to present it graphically in an informative way. So this all kind of dovetails into data communication skills. But we'll also be talking about principles of study design, experimental study design, and how data should be collected in a kind of meaningful way, such that we mitigate things like bias and confounding. And finally, we'll touch upon some of the important ethical considerations that come up when collecting and storing and presenting data. And this is always something that's important to consider when you're conducting a study experiment or collecting data and or analyzing it. So hopefully that gives students a lot to think about going forward. And so yeah, thank you.
Thanks, Leon. Great. Okay, and then so for our third course, Health Data Analysis and Machine Learning, I'm going to ask Dr. Rob Bergen, the Senior Data Scientist at UBC Data Science Institute, and the instructor for this course. Rob has extensive research experience in medical imaging and generative AI, and I'm going to ask Rob if you could give us a little overview of course 3.
Sure, thank you for the introduction. So the third course here is maybe slightly more technical than the other courses in that we introduce some advanced analytical tools like machine learning. So that being said, the course is designed to circumvent the need for any special skills like computer programming or advanced mathematics skills. You don't need to worry about that. But really the focus of this course is to try and get you to have hands-on experience with using machine learning models in various different contexts. So much of the course content is presented using a learning software program known as Weka. And so this is a free program. It's very lightweight, should be compatible with any kind of machine you're working with. So using this program, participants will gain hands-on experience, building various models, identifying trends, using data sets that will provide you to explore some real-world applications. And after the Weka portion, we do touch on some more advanced topics like natural language processing, which is a branch of AI that uses machine learning to enable computers to understand and communicate with human language. And then we will conclude the course with a focus on clinical data, including an introduction to text data analysis for clinical documents, as well as an overview of image data analysis techniques. So yeah, these highlights are basically designed to provide a strong foundation in health data science and practical skills applicable in the healthcare domain.
Thanks, Rob. Great, so that comes to the last slide of our presentation. I'm just going to show the Slido slide again for everyone to go there to enter in your questions, and then I'm going to stop screen sharing, and then we can take a look at the Slido questions. And we'll have all of our instructors as well as our program leads to help answer the questions that you might have.
Steph, I think there's also a bunch of questions in the chat. I don't know if we want to maybe go through them too while we're waiting for Slido.
Sure. Okay. I'm going to see. I see a question from Sana about what types of real world data projects are included in the course. Data projects. I'm not sure if this is referring to course 1 or course 3. I mean, which would be the best to answer that one? Like, there's real world data sets that are used in course 1. So a lot of the BC data sets, I'll just pull up what's there.
So Steph, maybe I could just make a comment that we spend a lot of time trying to design hands-on labs and then assignments that are based on real data, and we want the learners to be able to expose to the characteristics of the real data set. Now, given the online and the micro certificate program, we are not asking anybody to be doing a project, because that would take a lot more time. And but the assignments and the labs are really developed by are really based on real world data sets.
Yes. Yeah, and so for course 1, I know there's some population level health data sets that are used, health admin data, physician billing data, discharge abstracts, hospitalization data that are, and PharmaNet data that are all kind of used for the examples in the lectures. Okay, now we have 2 places where the questions are, but if you had a question in the chat that it might be easier if you copy and paste it into the Slido so we can kind of see them all in one place. The chat's a little bit hard to navigate. I see the first question at the top is, I'm already a professional data analyst. Is there a UBC course that would be better for helping me move into health? Raymond, maybe we'd like to take that one.
Yeah, I would say that we have in the past we have people taking the micro-credential program, and they're already professional data analysts on a completely different application domain. And from the feedback that we got, I think they find it useful for them to start understanding the various types of health data, the various types of business questions that we would want the data to be able to answer. And maybe I would say course 1, course 2 are really useful in that sense. I don't know whether course 3 will be the most useful for you if you're already a professional data analyst. If you haven't been using machine learning tools, I think course 3 will still be useful to you. But if you have already been using it and practicing it, then maybe course 3 it's not necessary for you.
And so the next question I see is, do we gain hands-on experience with SQL, Python, R, Tableau, or Power BI? Maybe Leon, you can touch about the Tableau, Power BI, since it's our visualization ones, and we're using something else in course 2. And then Rob, would you like to talk about the other programming ones for course 3?
Sure. I mean, I can just briefly mention that you won't specifically be using either of these dashboards, but we'll be, of course, getting you, like I mentioned, to essentially design your own. And so you'll be, in my opinion, learning all of the the most important aspects of dashboarding in terms of how data is loaded into them and how to effectively present data using dashboards. So I think that to some extent these skills will be transferable.
Yeah, and I know Google Looker Studio is used for course 2 for the dashboard building assignment. And Tableau and Power BI, we did that because Tableau and Power BI have you might need to pay for the license to use those, and Google Looker Studio was free and more accessible. Yeah, and Rob, I don't know if you want to mention anything about the programming languages.
Yeah, so we have no requirement for programming languages, and just to make this course accessible to everyone, we don't teach any programming languages. So all of the hands-on experience will be through this program that I mentioned called Weka, which is really just a graphical user interface where you can choose models, you can load in data sets, and you can kind of play around with different parameters of those models and see how outputs change given different conditions. So yeah, the programming, there is really no programming content in the course.
Yes. So we have a question about the Future Skills Grant. Is there a separate application to the program necessary, or just the Stronger BC application? There is a link through our Health Data Analytics webpage, where if you're interested in applying through the Future Skills Grant, there's a specific link you can click on. And then we'll be able to link it to your interest in our program, because you can apply the Future Skills Grant to a few different eligible courses or programs. But we just ask you go through our webpage first so that we can make sure that you're connected to the right program if you're interested in registering for ours. And maybe Sanghyun, if you can put the link in the chat for the for our Health Data Analytics registration page. Okay, so the question for certification to receive your micro certificate, what is the time limit for all 3 courses to be completed, for example, within 1 year? Right now, I don't think there is a time limit. So we have been offering these courses since the beginning of January 2024, and we do continue to plan on offering it in 2026 and beyond. So, I mean, maybe the risk would be if our offering schedules end up being less frequent, and it might be harder for you to complete all 3 if you've decided to spread it out over multiple years. And also our course registration costs do increase slightly by a small percentage every year, just to consider if you are planning on spreading out the 3 courses. But right now, there is no time limit. We just started in 2024, and people haven't done them sequentially and have had maybe a break between each of the courses. But if you have questions about that, please email us. So there's a question about any internship or job opportunities for data scientists in this area, maybe in UBC. maybe Raymond, you'd like to comment about that since you're at the Data Science Institute, and maybe you employ data scientists at the institute.
So I mean, I think I want to make it clear based on one of the slides that I have presented. So by just taking this micro credential program, this is not intended for you to be practicing as a data scientist. So from the point of view of the micro credential, there's no internship associated with it. The idea is that if you ended up really liking the direction and you would want to become a professional, there are opportunities within UBC, like the Masters of Data Science program, for instance, will be one obvious pathway. The Faculty of Science now have a data science major and also a data science minor, and so those programs will allow you to be properly trained so that you will become a professional. You'll become a professional data scientist. So I think UBC has a lot of those opportunities, but not so much in terms of upskilling. This is intended to be an upskilling program.
So the next question is, when and how will we be informed if we've been accepted for the Stronger BC Skills Grant? So we're accepting applications to the Future Skills Grant till I believe tomorrow, August 1st. I'm not sure if Neha's on the line, that she can clarify in the chat. And then the Extended Learning, UBC Extended Learning will be reaching out to all the people who applied and let you know which offering, the 2025 offering or 2026 offering, we can slot people in. Okay, she's mentioned that she's already started contacting people who have applied. But if you go on the wait list, we can, if you get a last spot or go on the wait list, we will also be contacting everyone in the next couple of weeks, if not already. How large are typical cohorts and what are the networking opportunities like? So I think typically in the last, they've ranged, it's gone from like 20 to 40 students. And in this upcoming September offering, we're expecting a larger cohort due to the Future Skills Grant applicants. So it'll be about 40 students per course. And the networking opportunities, as Raymond had mentioned, we do have those 1 hour per week Zoom sessions, which is a great chance for you to actually see people live on Zoom and other students in the course, but also through the course web learning management system on Canvas, you can chat through the polls, through the discussion posts with the other students as well. So I think there's plenty of networking opportunities, and we encourage students, learners to kind of reach out to each other and learn more about what their role is and whether there's opportunities to collaborate outside the course as well. I think that one was answered. This question is the micro certificate tied to a graduate student studies portfolio, and what are further opportunities to learn at UBC? I think the second question, Raymond already mentioned some of the other graduate programs at UBC. This micro certificate is a professional development upskilling course for professionals, healthcare professionals already. So we aren't tied to a graduate studies portfolio. It's a professional development under UBC's Extended Learning unit. And then how are course extensions handled? So yeah, there are assignment due dates, and we have a general, I think, what do you say? Like, we have a policy that if you have a reason to request an extension, we generally, as long as the request is reasonable, we have given extensions to students who have had things come up in their life that are impacting their ability to redo the assignment by the due date. So we ask that learners will email the TA for the course and let them know that they need an extension and a reason why, and we'll be able to grant an extension. For this question, for data scientists, can they publish papers?
So maybe I could answer that. I'm not exactly sure the context of this question. Leon and Rob, they are data scientists in the Data Science Institute, and we constantly publish papers in some of the best journals. Now, that is just in general. But if the question that you're asking, that if you have very little background in data science and then you ended up going through this micro-credential program, will you be qualified to be publishing papers on your data science work? I don't think that is the intent, but again, depending on the work you're already doing, I don't think there's a requirement for many journals that says that you have to be a certified data scientist to be publishing papers in the journal. So I don't think that it would be a problem, but I'm not fully sure that I completely answered what you're trying to ask from this question.
Yeah, we'll put our email in the chat as well if there's further clarity needed, if the question was not fully understood or answered. And the next question for Olga is about can people with a temporary work visa apply for the grant? I know there's the eligibility. If you go to the website, there's a list of the eligibility for the Future Skills Grant, and I believe you need to be a Canadian citizen or permanent resident and a BC resident living in BC. So I'm not sure if that would qualify if this person has a work visa. So but please go to the website to just double check all the eligibility. Okay, I think Neha kind of mentioned this applying for the grant and hearing back time frame for the grant. It would be a very short turnaround time, I believe, if you apply now, and we're already reaching out to people. Level of coding required or experience. Again, no level of coding is required. That's how they were designed, to be accessible to anyone who does not have that programming background or knowledge. So a question about what junior roles are graduates qualified in BC, and any examples of alumni in positions like data analysts. Yeah, so this is, I think, getting to, if you were to take our micro certificate, what kind of jobs or roles you might be eligible for. And I think Raymond kind of mentioned that this is an upskilling program. It's not necessarily training a full graduate program training you to be a data analyst, data scientist, but providing you with the foundations and skills in understanding health data analytics. I think I saw another question previously about, yeah, just wanting to know what graduates from what the people who've completed the micro certificate, what type of roles they've gotten to. I mentioned, like, this is a pretty new program, so we are going to be following up with our students who have completed all 3 courses, and just hear what their career paths have been, or what opportunities have been provided to them after taking the micro certificate. I don't have that data at this time. What devices are required and what is recommended? I guess maybe, Rob, you can just talk about the course 3, since that's the one that uses the WECA software, but I know it's pretty basic requirements of a computer, I believe.
Yeah, so there are no system requirements listed for this. I just know that, we haven't had any problems so far. My guess is that if your computer or laptop has been built within the last 10 years, you should be okay. But it's a very lightweight program. I don't think a tablet will work, though. I think it will probably need to be a laptop or a computer.
Thank you. Okay. And the next one I think I touched upon already. And are the courses transferable to a UBC certificate or degree courses? Not at this time. Right now, if you took all 3, you'll receive a UBC micro certificate. We're actually in the process of developing a second micro certificate course focused on natural language natural language processing to improve patient care. So still NLP related to health. And it's possible, we haven't explored it yet, that these two, if both microcertificates were completed, it may be able to make up a UBC certificate. But at this time, our courses are not transferable. Yeah. Should we apply for the grant first and then the program? I believe it's it's a one step. There's one place to register for the FSG, the Future Skills Grant, and then we will get the information that you wanted to apply for our program. So it's kind of rolled in together. So are there other microcertificates similar to this one, but less focused on health and clinical settings? Yeah, there are a number of UBC certificates. You can go to the UBC Extended Learning website to see the full range of offerings. There's quite a lot of different educational programming, probably something for everyone. I'm just going to go down to maybe, I think we might have answered some of these. So the limited funding for the grant does not reset in January. It's this one time you must apply for the grant, and you'll either be able to take the course in the 3 courses starting September or in January. Okay, I like this course about what the assignments are like. Is it focused more on data analytics foundation or the health context? So I think maybe if Leon and Rob, do you want to share a little bit about what the assignments are like in each of the course 2 and course 3? Maybe Leon, you can go first.
Yeah, sure. So the assignments take generally around 3 flavors. So there will be quizzes, which are fairly, I think, self-explanatory. There'll be regular assignments in the sense that, so at least as far as course 2 is concerned, they'll usually involve something that concerns, like we said, data communication skills and that sort of thing. So, for example, you'll be critically analyzing healthcare-related publications, so journal papers and things like that. And then the third flavor is actually more sort of discussion related. So there are online forums that you'll have access to as part of the course, and you'll be encouraged to really engage in some fruitful discussions with your peers and other students taking the course. And so I think those are like very important aspects of the work that's expected of you.
And yeah, so for course 3, it's roughly the same structure with discussions, assignments, and so on. The actual assignments will be, again, using this Weka software to give you more of a hands-on experience with the modeling. So, the lectures of the course will be describing maybe a specific machine learning model, and then the assignments will give you the hands-on experience with that model. So you'll be provided a data set, you'll be provided instructions on how to, say, predict a certain disease using some data set. And then we'll discuss, what do you think are the limitations of this model, what are its strengths, what are its weaknesses, and things like that.
Yeah, I know in course 1, it's a little bit different where they kind of, each week's assignment, you do a little bit of making sure you understand each of the lessons of the module that week, and you kind of build up to this final capstone project. And the capstone project is allowing you to kind of apply all the things that you've learned and seeing how you present like a healthcare challenge of your choice, and show how you might apply what you've learned, all the analytical techniques and data access, data quality items to your own real world application of your choice. Yeah, so I think we've kind of covered most of the questions that were shared in Slido. If not, please do email us, and feel free to reach out if you have further questions. the Future Skills, there's a lot of questions about the Future Skills Grant. And hopefully that Neha, you'll have some information from Extended Learning if they can provide any answers to your questions. But right now, we don't have any new spots opening in January at this time. We'll have to see if we get this funding, eligibility for this funding again next year from the government. So I think does anyone else have, from instructors or program leads, have anything left to add? I might wrap up this info session. Okay, so thank you so much, everyone, for attending our info session today. We hope you learned a bit more about our program, Health Data Analytics, Opportunities and Applications. If you are interested, please do visit the program webpage to learn. There's quite a lot of details on that webpage about when the next offering is and the topics and the instructor list. So we hope that you'll join us for our next offering, either this September or in January 2026. And look out for more offerings that we'll also be developing in 2020, or we'll be launching in 2026 as well. I really wanted to thank you for participating in our info session today. Thank you.